Continuation of care of special populations. Homeless population. It affects men, women, children, and persons of all racial and ethnic backgrounds. Risk factors among this population include early death related to chronic illness, substance abuse, environment exposures, communicable diseases, cardiovascular and respiratory disorders, skin disorders, and mental illness. Nearly half of this population experiences mental health issues and coexisting substance abuse disorders. Malnutrition and poor dentition are common and can lead to further health complications. Disability often results from illness. Disability becomes a barrier to employment, which further augments the problem of homelessness. Infants affected by homelessness often have low birth weights and are more likely to die within the first 12 months of life. Children affected by homelessness are sick with asthma, iron deficiency, lead poisoning, ear infections, gastrointestinal illness, and mental health and behavioral problems. Children may begin to act out or become less attentive in the classroom when basic needs are not met. Youth experience health problems related to risk-taking behaviors, such as alcohol and drug abuse, depression, suicide, unintended pregnancy, and sexually transmitted infections, including HIV or AIDS. Women experience high rates of unintended pregnancy and physical and sexual abuse. Health considerations for the homeless. Healthcare workers need to identify those who are homeless and should be done through avenues such as outreach programs. Initial healthcare visit and every visit thereafter need to be done with a non-judgmental, non-threatening approach. The nurse should focus on reported symptoms first. This will encourage adherence and follow-up. Subsequent care should include health maintenance, attention to social problems and or mental health problems, and establishing an emergency contact person if available. Homeless individuals often experience poor nutrition, sleep deprivation, violence, physical trauma, emotional trauma, and long-term exposure to toxic agents. Homeless individuals may not adhere to medical treatment recommendations and therefore require close follow-up. They tend to lack health insurance, have longer hospital stays, and have poorer health outcomes. Common conditions in the homeless population. Include anxiety, bipolar disorder, cognitive disorders, communicable diseases, complications from poor hygiene, poor living conditions, prolonged sun exposure, and prolonged standing, coronary artery disease, diabetes mellitus, domestic violence and rape, frostbite, heart failure, heat exhaustion, hyperlipidemia, hypertension, injury from violence, lice, scabies, bacterial infections, major depressive disorders, peripheral vascular disease, post-traumatic stress disorder, schizophrenia, sexually transmitted infection, skin and foot conditions, substance abuse, suicide, traumatic brain injury, unintended pregnancy. Certain medications should be avoided in the homeless population due to the potential for serious interactions with alcohol and recreational drugs, the potential for abuse, risk for dehydration, and contraindications in chronic conditions. Some of these medications include albuterol, benzodiazepines, beta blockers, bupropion, calcium channel blockers, clonidine, NSAIDs, and statins.